What can I do to make you happier? Is the question I just asked this brand new patient who left the operatory here, a fantastic 85-year-old who hadn't seen the dentist in 20 years. He came in to visit us today. How did he get here for his complimentary panoramic x-ray and consultation? Through a direct mail campaign. So when I start off my visits, I don't put on my loupes. I don't put on my mask. I sit across from the patient and chat with them for a few minutes. And this is how I start off every time. Hi, my name is Dr. Paul, sentence 1. I am so glad that you are here, sentence 2. I know the dentist is not everyone's favorite place, so you should be proud of yourself for coming, sentence 3. I have one question for you, sentence 4. What can I do to make you happier? Sentence 5. Those 5 sentences are magical. We're taught in dental school to say, what's your chief complaint? Which is like, what's the worst thing going on right now? Not good energy in a place people don't want to be at anyway. So I reframe that. I say, what can I do to make you happier? But that question's important because the patient will say something. And this patient lifted up his lips and said, these crowns have come off a few years ago. I'm embarrassed to smile and I want to get a better smile. So I also share with the patient that we're going to take a mouth tour inside their mouth and review the x-ray. So after doing that, reviewing the medical history, getting to know them, I do the brief mouth tour. And then I review what's happening on the x-ray. And I share with the patient, if you could just do one thing to be healthier, it would be on the lower right, where you have, I explain over here, healthy, 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 problem. This black area over here represents a group, represents bone infection, represents mush. And then I share, just like our office, if a fire started in that little trash can over there and nobody paid attention to it, the whole house could be on fire. So when you have an infection like this, and I'm so glad you don't have pain now, and I'm so glad you don't have outside the face or inside the mouth swelling, but things like that can cause major problems. So if left untreated, now I say, even if you decide to do nothing, we can still be friends. Even if you decide to do nothing, we can still be friends. But it's my job to tell you what happens if you do nothing. And if left with doing nothing, that tooth can cause a major problem, including major infections. Then we go over the structural problems with the wisdom teeth. We talk about the front teeth, where the teeth underneath, I like to use technical terms like the teeth underneath. I use a glove on my hand. I say if my hand disintegrated, turned to mush, those teeth have been mushified. That's why the crowns have come off. We will find out if it's possible to maintain those teeth or they may need to be replaced. Our direct mail campaign showcases the implants that we do. The patient was very impressed by how thorough the direct mail campaign brochure was, or this magazine was, the technology that we had, how we did many things in one place. That was something that was impressive to him. But then when you have this overwhelming treatment plan, extractions, removal of an infected tooth, 2 laterals that have been mushified, I always say, let's start doing a few good things right. So we start with comprehensive care, a hygiene visit, these small x-rays that we need, and removal of that number 31 tooth on the lower right. And I say, that's your starter treatment plan. That's a step in the right direction towards being healthier. After that's done, I say we have this very, very advanced dentist here, a surgical prosthodontist who went to school extra to do complicated cases, and we can get his opinion as we make a treatment plan together for long-term success. Make a treatment plan together for long-term success. But the hard part about these visits is not to overwhelm people with too much information, but also not to let them think they have no big deals going on. So how do you get people to put medium amount of attention to what's going on? So I did a video with this patient and he gave me the HIPAA consent, which was awesome for me to share with you. He shared about his experience, he shared about what he thought. I'll share that with you. But I wanted to share with you, that's how I start off with new patients. Hi, my name is Dr. Paul. I'm so glad that you're here. I know the dentist is not everyone's favorite place, so be proud that you came today. I have one question for you. What can I do to make you happier? And also as Dr. Nacho, I'd love to make you happier too, whether you're a dentist, a team member, a dental student, a dental assistant, anyone in the dental space. So please do not hesitate to reach out to me if I can help you in any way with the circle of dental life, from finding a job, buying a practice, hiring an associate, selling a practice, to in-game communication, just like I did with this patient here. We are all in this wild and wacky dentisting world together. The more we share, the more we care, the better world we will build together.